Firstly is introduction. Food preparation is commercial kitchen often involve repetitive tasks such as cutting vegetables. Traditional manual cutting can lead to awkward posture, forceful exertion, and repetitive motion injuries. To improve safety and productivity, many kitchens adopt choppers or food processors to reduce manual cutting. However, even with chopper, workers may still face ergonomic issues if the equipment or workflow is poorly designed.
Next, I will continue with the workplace background. Our study was done at Sida Catering, Batu Pahat, Johor. The mainly task is cutting and chopping vegetable in the food prep area by food handler. This repetitive task may cause muscle strain without ergonomic tools.
Work task process. There are 5 work task process in this case study. The first one is planning and food preparation. The second one is wash ingredients such as wash vegetables, fruit, meat and chicken. The third one is cutting and slicing the vegetables. Fourth, marinating and cooking process. 5, plating and packing the food. For the work task process, for proactive approach, the first one is establish an ergonomic assessment team. The second one is identify all work tasks and process. Third, spot potential ergonomic hazard. Fourth, review existing injury reports and data. 5, assess workstation and equipment design. 6, consult employees for feedback. 7, evaluate current tools and handling technique. 8, apply ergonomic controls and solution. 9, develop an ongoing ergonomic monitoring plan.
There are a few ergonomic issues. Food handlers face several ergonomic issues. They often bend forward and twist their wrists while using the chopper, which puts strain on their posture. To cut hard vegetables like cucumbers and tomatoes, they need to apply a lot of pressure, increasing physical effort. The cutting motion is repeatedly many times throughout the task, which lead to fatigue. As a result of this factor, food handlers commonly experience wrist strain and neck pain and fatigue.
My name is Alifa Iliana and I will continue this present. Based on our observation, we identify 3 key ergonomic risks while using the chopper. First, the fixed tool height. If the table or tool is not a proper level, user may need to bend or lift their shoulders, which can cause shoulder strain and poor posture. Second, the unsuitable handle size. If the handle is too small or too large, the wrist may bend unnaturally, leading to strain on the hand and forearm muscles. And third, prolonged static posture. Standing in the same position for a long time without movement can cause leg and lower back fatigue. These risks highlight the need for a better ergonomic design to reduce physical strain and improve user comfort.
Next, I will continue with the design. This is the concept of our new tools. The main structure is made of stainless steel, which provides strength and durability. And then we use the semi-transparent plastic for better visibility and a modern look. At the base, we use the silicone anti-slip material to keep the device stable and prevent it from moving during use. And this combination of material can improve our safety and efficiency for our food handler.
ErgoChopper Ergonomics offers many positives to users. It can improve the safety in the kitchen through an automatic safety system that will stop the blade and when the lid is open, thus can reducing the risk of injury. In addition, these tools save time and energy because the chopping process becomes more faster and more easier, which is can helpful especially for busy users, the elderly or those with joint problems. This convenience also encourage a healthy lifestyle because when the food preparation become more easier, users tend to cook at home and not rely too much on fast food. The ErgoChopper Ergonomics offer many positive. There are some negative to consider. The higher initial price compared to a regular manual chopper may keep less affordable for some users. In terms of maintenance, this still require a careful cleaning extra food reprise can cause odors or contaminations, requires users to be extra careful. Additionally, depending to a model, this tool may use electricity, and if used frequently, it can have a slightly impact on your monthly electricity bill.
For preventive, there are 5 levels of hierarchy of controls. The first one is elimination, second one substitution, the third one engineering controls, fourth administrative controls, and PPE. The highest level is elimination, that have most effective way to reduce the injuries, and the most less effective way is PPE.
Based on the hierarchy of control, several improvements can be suggested to enhance user posture and reduce the physical strain when using the ergochopper ergonomics. Under the engineering controls, adding a handle with an ergonomic angle can ensure a more comfortable grip and can reduce the force needed to operate the tool, thereby minimizing stress on the under wrist and shoulder. For administrative control, providing a training in the ergonomic use of tools such as tutorial videos or demonstration can educate user on proper posture and can help prevent joint strain during the operation. Under the personal protective equipment, PPE, supplying anti-fatigue mats for users who stand for long periods can reduce the pressure on the feet, while using wrist support glove can assist in stabilizing movement and minimizing muscle fatigue if the level requires higher force. For the ergochopper ergonomic, users begin by placing the ingredients such as vegetables, fruits, and potatoes into the metal cutting grids, which is a perforated surface with blades underneath. The users then presses down on the long ergonomic handle that apply a pressure pushes a cylindrical metal press down into the ingredients, forcing them through the cutting grid and producing clean, even cuts. The chopping ingredients fall directly into a transparent plastic container positioned neatly beneath the grids. This container can be removed easily for cleaning or transferring into the contents. Once one cycle is complete, the user leaves the level and repeats the same step for the next batch of ingredients.
Next, we go to checklist for awkward posture. Based on the assessment using the awkward posture checklist, we found that users are exposed to several high-risk working positions, such as bending more than 13 degrees, raising the arms above shoulder level, and tilting the head forward more than 45 degrees. All of these postures were performed for more than 2 hours per day, which exceeds the recommended safe exposure limit. This prolonged posture places continuous strain on the shoulders, neck, and lower back muscles, increasing the risk of musculoskeletal disorders if no ergonomic improvements are made. The assessment shows that the use of the tool involves several awkward postures, such as bent or deviated wrists, arms raised sideways or extended excessively, as well as prolonged squatting and kneeling position for more than 2 hours a day, which can place continuous strain on muscles, joints, and the musculoskeletal system, ultimately increasing the risk of the ergonomic injuries if not addressed. Based on the checklist for static and sustained work posture, it was found that 2 postures exceeded the recommended exposure duration are considered risky. First, working in a static or awkward position involving the upper body such as the neck, arms, and wrists, and standing for more than 2 hours continuously with minimal leg movement. Meanwhile, one posture working in a seated position with minimal movement did not exceed the time limit and is not considered a risk in this assessment.
For forceful exertion, this slide shows different manual handling activities that involve forceful exertion. So firstly, out of all these activities, only one exceeds the safe limits, which is pushing and pulling. This activity requires an advanced assessment because it poses a higher risk. The other activities are still within safe limits, but we still need to follow the recommended weight guidelines. Next, insured pushing and pulling is the most critical activity to watch out for.